Just a quick disclaimer before the video starts. I'm really terrible at editing. Like, genuinely, I can't wrap my head around it, but I also can't afford an editor. But I still want to create content, so I'm kind of struggling to find an in-between. So I just want to let you know that these videos are going to be mildly edited, as in audio is going to be tweaked. I can handle that. There's going to be some pictures just to give something on the screen. But for the most part, this is meant to be listened to in the background while you're working, driving, trying to sleep, etc., etc. So thank you so much for understanding, and let's go ahead and get into it. What is schizophrenia? Schizophrenia is easily one of the most misunderstood and sensationalized mental illnesses, and it's not hard to see why, with movies such as Split, Joker, and Donnie Darko, just to name a few. And while these movies have made schizophrenia seem like a terrifying and dangerous illness, the truth is far less scary for us, and much more scary for the folks struggling with such things. So in this video, let's break down exactly what folks with schizophrenia have to deal with on a day-to-day basis. How does psychology explain schizophrenia? Well, according to psychiatry.org, schizophrenia is a chronic brain disorder that affects less than 1% of the US population. When schizophrenia is active, symptoms can include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. However, with treatment, most symptoms of schizophrenia will greatly improve, and the likelihood of reoccurrence can be diminished. Well, what about what causes schizophrenia? While scientists have tirelessly studied schizophrenia, there is no known cause for it yet. However, scientists believe that it is caused by a mix of genetics, brain chemistry, and environment. Because of this, as you can imagine, treating it is incredibly difficult. But before we discuss treatment, let's discuss some of the many symptoms most folks can experience while struggling with schizophrenia. Psychosis. According to psychiatry.org, psychosis refers to a set of symptoms characterized by a loss of touch with reality due to a disruption in the way that the brain processes information. When someone experiences a psychotic episode, the person's thoughts and perceptions are disturbed, and the individual may have difficulty understanding what is real and what is not. Delusions. Fixed false beliefs held despite clear or reasonable evidence that they are not true. Persecutory or paranoid delusions, when a person believes they are being harmed or harassed by another person or group, are the most common. So this is people who assume that a group of people don't like them or saying rude things about them. This can be a form of delusions, because in reality, those people may not be saying anything about you. Hallucinations. The experience of hearing, seeing, smelling, tasting, or feeling things that are not there. They're vivid and clear, with an impression similar to normal perceptions. Auditory hallucinations or hearing voices are the most common in schizophrenia and related psychotic disorders. Disorganized or abnormal motor behavior are movements that can range from childlike silliness to unpredictable agitation, or it can manifest as repeated movements without a true purpose. When the behavior is severe, it can cause problems in the performance of activities of daily life. It includes catatonia, when a person appears as if in a daze, with little movement or response to the surrounding environment. It's important to note that when the disease is active, it can be characterized by certain episodes in which the person being affected is unable to distinguish between real and unreal experiences. Cognition is heavily impacted by schizophrenia. This leads to problems with attention span, concentration, and memory, as well as declining educational performance. So typically, schizophrenia is seen in older folks, but earlier symptoms can occur, such as a child struggling to pay attention in school and things like that. The symptoms of schizophrenia first appear in early adulthood and sometimes must persist for 6 months before a diagnosis is made, with men often experiencing initial symptoms in their late teens to early 20s, while women tend to show first signs of the illness in their 20s and early 30s. Subtle signs may be present earlier, including troubled relationships, less than stellar school performance, and not much or reduced motivation. Phew, that was a lot. But let's talk about possible treatments for schizophrenia, assuming it can be treated, right? Well, again, let me reiterate that I am not a medical professional. I am simply doing this video for educational purposes. Nothing I say should be taken without speaking to a psychiatrist first. I'd like to also reiterate that there is no cure for schizophrenia. The vast majority of sufferers of schizophrenia do very well with treatment, only experiencing minimum symptoms that will include a mix of medications and psychotherapy or talk therapy, as I previously spoke about in my last video about agoraphobia, including cognitive behavioral therapy. These may enhance the function and reduce the symptoms slightly, but early diagnosis is key to controlling the acute symptoms and managing them so they don't become more severe. Oftentimes, substance abuse can lead to difficulty diagnosing, however, schizophrenia, since many of the symptoms of drug abuse mirror that of schizophrenia. For this reason, they should both be treated in tandem alongside each other. Now, what about rehabilitation and living with schizophrenia? Well, treatment will help many folks suffering with schizophrenia to live mostly normal, successful, and highly functional lives, while others may remain symptomatic. After the symptoms of schizophrenia are controlled, various types of therapy should be continued to help people manage the illness and improve their lives. Therapy and psychosocial supports can help people learn social skills, cope with stress, identify early warning signs of relapse, and prolonged periods of remission. Because schizophrenia typically strikes in early adulthood, individuals with this disorder often benefit from rehabilitation to help develop life management skills, complete vocational or educational training, and hold a job, for example. Supported employment programs have been found to be very helpful with people with schizophrenia to achieve self-sufficiency. These programs provide people with severe mental illness competitive jobs in the community. For many people living with schizophrenia, family support is particularly important to their health and well-being. It is also essential for families and friends to be informed and supportive of themselves. Organizations such as Schizophrenia and the Psychosis of Action Alliance, Mental Health America, MHA, and the National Alliance on Mental Health Illness, NAMI, offer resources and support to individuals with schizophrenia and other mental illnesses and their families. Optimism is important in patients like it is with any disease that you may face. Family members and mental health professionals need to be mindful that many patients have favorable course of illness, that challenges can often be addressed, and that patients have many personal strengths that must be recognized and supportive. In other words, make sure you figure out which treatment plan works best for you or best for your patient, and then move forward with that. Have an open dialogue, open communication. One thing that worked for, let's say, John, won't work for Jack. And it's important to keep that in mind. Otherwise, you're not going to be very successful in treating or helping manage schizophrenia. Thank you so much for tuning in. Make sure to hit the subscribe button and stay up to date on my videos. Leave a like as well if you learned even the smallest detail, and let me know in the comments below if you or someone you know is struggling with this illness. Please be mindful, as Hollywood has sensationalized schizophrenia and made it seem terrifying, when in actuality it's just like anything else. It does not make you a serial killer or a horrible person, so please be sympathetic. It only affects roughly 1% of the population in the United States, and usually people over the year 18 years or older. Hollywood makes it seem as though schizophrenia is a horrible thing, and I can attest to this, as I have a cousin who suffers with it, and unless he tells you, you likely would have no idea. This person does not display many symptoms, and that's because they are currently 37, and they have been treating it for a very long time. They have learned how to manage their symptoms and to deal with it, and honestly, sometimes that is absolutely the most important part. So we have to look forward. It's important that we don't diminish people like this or treat them like they're crazy, because that doesn't progress us anywhere as a society. We need to support them, uplift them, and be optimistic towards them. It's just like anything else: depression, cancer, bipolar disorder. anything. These things need to be enforced, they need to be treated, but these people are everyday folks just like you and I. They're human beings with a feeling. They feel things, they hurt, they cry. Their hearts are full. These people just want to be respected and loved like everyone else. So please be mindful when you're speaking with them or when you're talking to them. And odds are you won't even know that they have schizophrenia unless they tell you. You probably won't even know something is up. So again, thank you very much for watching. Remember to be mindful. And I hope you guys have a wonderful day.